Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes. As usual, I am trying to do something different from what I normally do. And this is reading part A and how to do reading part A. That is a strategy. As I have already told you many a times, and obviously the people who have been here for long, I mean the candidates who have been here for long watching my YouTube videos, and on the top of it, the students who are studying from us, they all know how to do reading part A, but I will revise all these things for you so as to make sure that you understand each and everything. So first of all, I have told you about the strategy. So today also, I would like to tell you about the strategy. But before I tell you the strategy, please subscribe this channel and also keep watching our videos. And as I always say, if you want to watch the videos till the end, because obviously you learn lot of good things after you watch the end of the video, because there are many things which I miss early, then I talk about those things. So in the OET reading part A, again, I'm telling you precisely, please listen to this video very nicely. In the OET reading part A, you get 15 questions or 20 questions and you get only 15 minutes. The reason behind this kind of strategy is that they want to see whether you panic. Suppose if you are attending a patient, if he is in a life threatening situation. So if you panic, you create a chaos. Whereas if you do not panic, you are able to handle the patient. So that is why reading part A is a pure skimming and scanning based question paper. That is why you get 20 questions and only 15 minutes. That is, they want to see whether you panic or not, and they want to see how do you react when the situations are tough. So that is the motto. So in 20 minute questions, you have to do in 15 minutes. So in 1 to 7 questions of reading part A, you have to just write A, B, C, D. So these are the four texts. If I give you as an example, so I will take an example from here. Just a second. Yeah. So this is the example. So this is the question paper you're going to get. 1 to 7 questions. You just have to write A, B, C, D. A, B, C, D means out of text A, text B, text C, and text D. You just have to write in which text has it been given. So first 7 questions are very simple. Now there are two mistakes which students often do. Sometimes they start with question number 8. I would really encourage, no matter from where are you studying, please do not start from reading from question number 8, because you need to do question number 1 to 7. Out of these, 4 to 5 questions would be very easy. Very easy. You do 4 to 5 questions out of 7. Please, now I'm getting very precise. Listen to the information very carefully, because that is how you will learn how to do 20 questions in 15 minutes. Only 4 to 5 easy questions. Only 4 to 5 easy questions out of 7. Please do not do all the 7 questions. Do not do all 7 questions. Never. It's only 4 to 5. Why? Why we are doing so? First, to save time. Because if we waste our time in difficult questions, even if you waste even 1 minute, so out of 15 minutes, you have only 14 minutes. If by chance two questions are difficult and you waste 2 minutes, then you are left up with 13 minutes. So in the part A, the most important thing is to keep moving, keep moving. If you are unable to find the answer, please keep moving. Second, why not to start from question number 8? Because out of the 7 questions, 4 5 questions are easy. So if you do these 4 5 questions in like 2 minutes, then you have then the time left is 13 minutes, and now you have to do only 15 questions. So you can well understand that you have been able to manage the time. If you do 4 or 5 questions, now 15 questions are left and 13 minutes you have. So that makes the equation almost 1 minute, one question, which was earlier appearing to be much less, 15 minutes, 20 questions. Now it is only 15 questions, 13 minutes. So that is what is the strategy. Now, the most important thing I want to tell you about this small thing before I start the reading, that when you will do question number 8, after following this strategy, please listen to this video again if any point you have not understood. When you will reach to question number 8, 9, 10, 11, these all will be the fill in the blanks. So first 7 questions A, B, C, D, and then 8 to 11, 12, 13 questions, you have to write fill in the blanks. 2 to 3 words maximum. 3 words maximum. So 8, 9, 10, 11, 12 questions. These are the questions. When you will go to question number 8, if you follow the strategy of doing first 7 questions, so even the question number 8, you will be able to figure out whether it is in the text A, B, or C, or D. So it will save your time, because this reading part A is all about skimming and scanning. Suppose if I can understand that question number 8 is in B, then I am saving 5 seconds. If question number 9 I can trace it is in C, then I am again saving 5 seconds. So if I save 5 seconds in each question, 5 seconds in each question, so you can well understand that if I have 15 questions, so I'm saving 75 minutes. So again, 75 minutes, 75 seconds. 75 second means 1 minute and 15 seconds. So these small margins in reading part A, when you have got total 15 minutes, if you save 1 minute, that means you can do 2 more questions. So that is how you will be able to complete. Now I will try to implement the same strategy on this reading. I don't know what reading it is all about. So first of all, you will go through this thing. Look at the 4 text A, B, C, D. Each question 1 to 20. Write your answers on the spaces provided. You have to write your answers here. Answer all the questions within 15 minutes time limit. That means after 15 minutes, examiner will take away your exam. So now, name, I will read the questions only. I have to do A, B, C, D. Name of the instrument to find out the symptoms. So I will mark my important words. Name of the instrument to find out symptoms means to find out symptoms. Symptoms is the keyword, instrument is the keyword. Method of infection transmission. No arrival for follow-up. Follow-up is the important word. Treatment provision for 1 month. 1 month is also a very keyword, because 1 month can be easily read. It can be 30 days, 1 month, and treatment. So the first question was instrument, symptom, infection, follow-up, treatment, 1 month. 20% people. Risk of infection increased 3%. Poor compliance with medication. So now I know bit of my answers. I will straight away go to paragraph A, and please try and understand now. In the paragraph say Helicobacter pylori infection. So Mr. Smith, 43-year-old taxi driver, symptoms are here. He takes no medication, medications word are given. Mild, does not do exercise. Zentec is the medication name. Repeated prescription word is there. Brochure, waiting room, then 2 drug names. So in this paragraph, I can find drug names and bit of symptoms. Second paragraph, prevalence of H. pylori, this methods and material. So I can read about the methods, triple eradication therapy, HPSA test. So these are the investigations. Then in the text C, there are results and there are conclusion, stool antigen, this and that. Then I can go to paragraph D. Is a bacterium that infects surface of the stomach, essential component, peptic ulcers, indigestion. I'm just reading the keywords. Again, symptoms. Those who do have symptoms may experience indigestion, abdominal pain. So symptoms again are there. So symptoms are given either in first or in D, A or D. No one is completely how it spreads, method of contamination, method of transmission. The infection in Australia is often acquired in childhood, age 30, 60, and then this and this. So that is what I have read in this part. And 4 weeks means 30 days. So if timing, medication plus 4 weeks means almost 30 days. So 30 days means 1 month. So now I will try to find the keywords. Name of the instrument. Name of the instrument either will be given in A. Examination reveals instrument names. During the examination, no name is given of the instrument, so I will not waste my time. This seems like a difficult question. In the D part, I will see if there is any instrument given. Formation of this, formation of stomach, peptic ulcer, however, does not necessarily means symptoms may experience. No, it is not completely. So this question, first question, is difficult for me. In the symptoms paragraph A and D, I have not been able to find the instrument. So I immediately leave this question. So that is the main strategy to leave this. Method of infection transmission. This is easy. Methods of infection transmission. I read about some methods of transmission. There was something like transmission that was surely given. How does it transmit? I think that was given in the D paragraph itself. Methods of transmission. how it spreads. Does not spread by this, so it should be in the D. So again, this question I am not sure, but transmission or infection spread is given in D, so I will do D. This seems like a difficult reading, but I will carry on with the flow. No arrival for follow-up. No arrival for follow-up acquired by the no arrival. No one is completely sure how it spreads. Again, no arrival or follow-up. Again, this seems like again a difficult question. So this seems like a difficult reading. I'm unable to get anything until now. So, but again, I will not waste my time. Treatment provision for 1 month. So that I could figure out the 4 weeks. So at least I could find one question. This will give me confidence. 4 weeks treatment. So 4 weeks means 1 month. Thank God I could find one question. About 20% of the people caught infection. 20% of the people, the success rate of eradication therapy. Following therapy, both groups have significant reduction. This eradication therapy, the use of stool antigen test, effective diagnosis. Stool antigen test method, instrument word is not found. 20% of the people, 20% word is also not given, but the percentage is given only in this paragraph. Here, see. So if I do not find anything, this is the only paragraph I can target because statistics are given in this paragraph. Even if this is wrong, I can't help it if my reading is difficult today. But again, I want to see all the questions. So that is why I will go fast. And again, I will do this C because the percentage is only given in this thing. So even if it would be wrong, I can't help it. Risk of infection increased almost 3%. So again, percentage is given in this 2.94 fold. So it's like 3 times. It should be 3 times rather than 3%. So again, I would do C. Poor compliance with medication. So poor compliance with medication. Medications are given here. Poor compliance, methods, results, conclusion, equivalent. Poor compliance with medication can be in the last. Poor compliance with the medication. Nah, again, a difficult one. So this reading seriously is a difficult one. I have not been able to find much. Neither I could trace the instrument. Otherwise, instrument should be very conspicuous. Maybe I'm doing in hurry, but that is how I save my time. At least I have done 4 questions, out of which some can be wrong. Or at least 3 questions. Some can be wrong, some can be right. But again, my job is to keep moving. Sorry, my job is to keep moving. How many groups showed reduction in symptoms? So how many groups showed reduction in symptoms? So both groups showed us statistically. So both groups means 2 groups. So this increase was following therapy. Both groups showed a significant reduction in symptoms. So thank God again I could both means 2. So that is where you have to be specific. How many means number. So you can't write both. So you have to write 2 according to me. Which medication is available without prescription? So this should be easy. Over the counter medication, Ranis. Ranis is the medication. Over the counter means that is available. Over the counter medications are those medications which are available without prescription. Like you can buy paracetamol over the counter. So Ranis is the word. So at least I have found 2 questions. So 2 plus 3, 5. But I'm saving my time. The most important thing, I'm saving my time continuously. How many drugs were used to treat H. pylori? So drugs, these 2 drugs, I think there are only 2 drugs which are used to treat. Any other information? Zentec, Renis, 2 drugs only. And if there is any drugs over here, treatment part, now over here nothing is given. And aims, materials, methods, results. So methods, there can be some drugs. 1, 2, 3. So were treated with triple eradication. That means 3 drugs. So I was thinking about 2, but it should be 3 because triple eradication therapy means 3. So that is now my pace is getting better. My confidence is getting better. So that is where I need to invest. Total number of patients included in the study. Again, this seems like an easy total number of patients. So over here should be total 49 patients. 100 dyspeptic patients, 14 and 49 patients complaining other. So total number should be 100 plus 49, 149. Any other patients? Nah. So this seems like 149. So now my pace is getting better. So that is why I am telling you to save time. How many H. pylori symptoms patient are asymptomatic? So I have to find the patients which did not have symptoms. I read somewhere the patients who did not have symptoms used to have pre-therapy, the success. The patients do not have symptoms. The patients, those who do not have symptoms. So how many? In most people, there are no symptoms. So how many people? I can say majority of the people. How many H. pylori patients are asymptomatic? Majority of the patients. That's the only thing I can write because it is majority word that's only fit in over here. So majority of the patients. So most of the patients, majority of the patients. What is the causative agent of H. pylori infection? It obviously would be H. pylori. So you can well imagine if 1 to 7 questions were difficult, but 8 to 13 were in my range. So that 8 to 14. So that is where I save my time. Helicobacter dash is common infection in Australia. So Australia is my keyword. Australia, I would be able to see very easily. Australia word is not over here, not over here. Australia should be a very, very clear and conspicuous word. Conspicuous means should be very easily readable or noticeable. So Australia word should be there. Australia word in Australia. So now I have figured out that it is in the paragraph D. I just need to see where exactly. Helicobacter dash is common infection. This infection. So this infection means no one is completely how it spreads. This and this. It means H. pylori is a bacterium. So it is talking about H. pylori only. So that is the infection. This infection means H. pylori only. H. pylori, nothing else. So that is the only infection they are talking about. So this answer should be H. pylori again. Some patients Helicobacter H is given, so we have to write pylori only. Some patient dash using simple antacids. Antacid Rennies were given. Rennies was given even in here only. Rennies. So Rennies. Some people, some patient dash using. Some people dash using. Some people are using, some people dash using, are using, maybe using. So this seems like a difficult question. I will immediately drop it. Its transmission is thought to be by. So what is causing this transmission? Its transmission is thought to be by. How is it transmitting? So transmission paragraph, we were doing that transmission was given and this thing. So this is a difficult reading, trust me. So in this, obviously, I'm telling you, please underline my words. Please understand if the reading is difficult, the cutoff will go low. It is not like IELTS that you have to score 30. So this is the most important thing so that you do not panic. Just keep on doing what you are doing. So again, I forgot the question. Is its transmission is thought to be by. So how does the transmission happens? We were reading transmission somewhere. Transmission. Now when it has spread, most likely route is hand to mouth. So transmission is hand to mouth, more common in spouses, but do not spread by intro. Is thought to be by hand to mouth should be my answer. I do not have any other option. Eradication of organisms was seen in dash number of cases. Eradication was like removal. Eradication was like removal. Eradication therapy was here. So in the conclusion, there should be the test was repeated for the patients who received eradication therapy. So in the results should be this thing. While the incidence among dyspeptic was 60%, the rate 34.7, H. pylori rate among dyspeptic was significantly high. The increase was statistically different. Following therapy, both groups showed this. When all the patients were considered, the success rate was 58.9%. So my question was, the eradication of organism was seen in 58.9, but the success rate of eradication therapy was 80.5. So this is confusing again. So I will do that later on. I will not waste my time. Typical dash of H. pylori is typical symptom. That is obviously indigestion is a symptom. So I can fit it without even watching. Typical symptom of H. pylori is indigestion. I don't have to worry about this. In a recent study, 60% of the dyspeptic patients should positive, positive, 60% of people should have positive, 60%. I need the word 60%. 60%, 60%, 60%, 60 word was given here. I could see some 60, but this is age 60. I need the percent. 60%. Not here, not here, not here, not here. 60% seems to be this only. 60%. Here it is. So while the incidence of this peptic was 60%, the rate of success was this. In recent 60% showed positive, positive, Now this is also a difficult question because it does not say positive word. The H. pylori among the dyspeptic patient was significant. Positive H. pylori infection, positive dash antigen word is also important. Antigen word, if ever is given, antigen word I could read just now. I just read the word antigen somewhere. Antigen, yeah. So stool antigen. So and I am just noting with the antigen word. Only stool word is fitting in with the antigen. I could not find any antigen word anywhere. So this is the word. So now I will not waste my time. I will go back to my question number 1 to 7. Name of the instrument to find symptoms. So that is where I will now put the flukes on. My speculations, my guess. So question was again, name of the instrument. Name of the instrument, attends his annual medication, complains of examination, word is given here, but there is no instrument. I'm surprised. There should have been some instrument. Waiting room, but this is the only thing they are talking about. If I do not find it in D, then I will go with A. Instrument. Infection, formation of we recognize essential, no instrument, no instrument, no instrument, no instrument, no instrument. In gram negative crestic mucosal, I cannot find instrument, so I have to put either A or D, but my heart says A because here it was doing the examination. So I have to take the risk, even if it is wrong, I can't help it because I cannot see any word like instrument. So can't really help it. I haven't been able to find, but again, wasting time is not an option. Methods of infection transmission that I have done in methods of infection transmission that for sure I will do with the spread word. That was spread word was given in D. I will not change it. Can't really help because method of transmission should be in D only. Yeah, D. So I would keep it D. Brochure in your waiting room, ulcer bug. So A, D, no arrival for follow-up. So no arrival for follow-up, but did not return for repeat. Thank God I could find one more. A for sure. Did not return for repeat prescription. Did not return for, thank God. A 100% sure. Treatment provision for one done. 20% people infection done. Risk of infection that was done. Poor compliance with the medication was done. Whatever the flukes I made. 8 to 15, I did all those questions. So this is my final answer. I hope my 15 minutes would be over. Maybe more than that. But this is the method that you want to try and you want to judge where exactly it is. So this is how we should do reading part A. It takes a lot of, you know, positivity. But again, to make it very precise for you all, I would like to re-mention, guys, please do 1 to 7 questions. Do not leave them. Even if you do 4 or 5 questions, you still will feel that you have done some questions. Then if the rest of the questions are easy, like 8th question, I could figure out this should be in this paragraph, 9th question should be in this paragraph. So it saves times. Even if in 15 minutes, you can save 2 minutes. So you can well understand you might do 3 more questions. So if today you are telling me that I can do, sir, 15 questions in 15 minutes, I will say if you will follow this strategy, you will be able to do 18 questions. And 2 questions will be difficult. If you will leave these questions, the difficult questions anyhow would be wrong. So affording 2 or 3 long questions are fine. We want to score around 17 to 18 in the reading part A. If luck is with us, obviously we want to do 20 all questions, but never leave a question. I'm not telling you to leave a question, but follow this strategy. Please listen to this video again to make sure you have understood. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you. And I assure you, if you follow this method, then it is a plus. Again, I say you one thing again and again. I tell you to listen my videos till end. Now I am giving you the most important information. Sometimes we work really hard on part B and C, but please understand 20 questions of part A, 22 questions of part B and C. Part A is for 15 minutes. Part B and C is of 45 minutes. So you can well understand half of the questions you can score in 15 minutes. So mean in 15 minutes only, you can be sure whether you will pass in reading or not. So this reading part is very important, which people do not take that seriously and do not practice enough. If you are scoring 15, please try to take reading part A to 17 or 18. Once you start scoring 17 to 18, you will feel on the cloud 9. You will be 100% sure your reading will pass. And also on the top of it, it is manual checking in the reading part A. So make sure you are writing everything very nicely. Clean, nice. You can't be in the running letters. Obviously, you have to write running, but write it very nicely. And whether to write capital words or not, no, you have to write the normal words. Like in the first questions you will say A, B, C, D in the capital. Then in these you can write anyway the first word can be capital. In this you will write the smaller words, all the smaller words. So there is not important to write capital words. So now I'm just gonna take you and will unmute you to ask what you have learned from it, and also to tell me what questions are right and what questions are wrong. Also, I could see the answers were nearby, but I did not have the time to check. So the first question I have done wrong, maybe because I did A. It does not say A. First question is wrong. But anyhow, let's check rest of the questions. So if you can help me, guys, what was the second question that we did? Method of transmission infection. That we did D. It was right, I guess. We did it in the D. I'm just gonna unmute you to help me. Sorry, I did not unmute you. So I'm unmuting you guys. Please help me. And part third follow-up, that was 100% A. I have no doubt in this. Treatment follow-up for 1 month, 4 weeks, wala 100%. I am sure that should be correct. It was in the B only, I guess. B, fifth question. And 20% of the people caught infection. This was, I was not sure. I don't know what I did as an answer. Hope you was noticing it. If you will not, you have the recording. Sixth question is C. Sixth question, risk of infection increased by, I hope I did C only, risk of infection, because I was saying percentage was given in this. So that sounds all right. Sixth question is for sure right. And then I will see question number 7, poor compliance with medication. That I don't know which I did as an answer. I will check it out what's the answer. It's A. I hope I did A only. I'm not quite sure, but this eighth question I did 2. That's fine. Lenny's I did fine. 3 I remember I did fine. Spiral that I could not find. Oh, I did not read the word shape. This question was easy. I did wrong. 149 right. Majority was right. H. pylori was perfect. Helicobacter pylori was perfect. Some patients self-medicate. This I could not understand. Hand to mouth was good. 82.5. I was confused between the two percentage. So can be right or wrong. Symptoms right. Stool. So almost like 15 to 16 questions are right. But again, I was teaching you. I had to talk about these things. Obviously, if I do alone, I will be able to do 1 or 2 questions more. So please understand that is how simple you can make reading part A. Are you all getting my point? Please, if you have any doubt, feel free to ask now. Please. Any doubt, please, in the reading part A. Any doubts, please? I have unmuted you. You can speak. You can contribute, please. Any doubts? In the strategy, in anything that
No, sir. No doubt.
rest of the people, please. We are like 82 over here. I must listen to the voice. At least.
No, sir, it's clear.
No, sir. No, sir.
Thank
No,
you.
sir.
Yes,
No,
sir.
sir.
So again, I'm telling you the basic strategy, coming back to the main plan again. Please, coming back to the main plan again. The plan is very simple. You start from 1 to 7 questions. Then you do question number 8. In question number 8 also you can identify that if it is talking about transmission, that would be given in the D. If it is talking about the results, that would be given in the C. If it is talking about methods and study, then it would be in the B. And if there is our symptoms and other things, then it would be in that thing. But I could not find the instrument word. That was surprising because it says B, but I was amazed because this answer otherwise would have been easy, but I could not find the instrument. That was surprising. In the part B, some instrument is given.
Sir, like
Yes,
a
sir.
5 point like
Sir,
scale
6
was
week के
used.
आगे 5 point like
Like a scale, sir.
Who is that?
sir 6 weeks. 6 weeks.
Last
Next
2
line.
lines. Last line.
Yes, sir.
Okay. I don't know whether it is an instrument or not. So that was the confusion for me. I was looking out for some option like endoscope, laparoscope, something like X-ray machine. Matlab, I obviously X-ray nahi, endoscope, laparoscope. I was trying to find something like that instrument. So Likert scale, I do not have any idea. So obviously this question, see, that is what is the point. If I get myself stuck on the question number 1, my reading is gone. That is the main strategy. That is why when you people say that, oh sir, I'm unable to complete this in 15 minutes, that means you are getting stuck at the question which you do not have knowledge of. So if I keep on finding this Likert scale, I will never be able to find, and my whole reading will go in vain just because of question number 1. So you can well understand how important is to leave the questions when you do not know them, how important is to follow the strategy of text A, B, C, D, so that when you reach to question number 8, 9, 10th, 11th, then you save your 5 seconds or 10 seconds in each question, so that you can, suppose if I generally talk, again I will let you know what I want to say by this statement. Suppose if I reach to question number 17, transmission. So transmission word, I know it was given in the D paragraph, so I straight away went into this thing, transmission. So most likely route is hand. That is why it was simple for me, because I followed the strategy in the question number 1 to 7. If let me give you another example. Let me give you another example. Suppose if I am doing question number 14, what is the cause? This was simple. Total number of patients included. So I know that is going to be in the part B, because that is where the study was. This was the study. So total number of patients would be around here. And when it would be talking about conclusion results, then results were here. So total number, I always knew that it's going to be somewhere here. So that is what saves my time. That is what I can do efficiently. That is what makes it sure that I am saving my time. So I do not save my times in only leaving the questions, but I also save my time in this strategy where I know that question number 8, 9, 10th would be in this paragraph. That is what saves my time completely. So please, guys, follow this thing. Again, this is Dr. Bhupesh from Dr. BKM Institute. Please subscribe our channel if you have not. And our contact number is 76967 34256 for the best OET coaching. Thank you very much.